guys,
welcome back to our YouTube channel.
And this is the Ajayi family. Are you forgetting that?
Oh yes. If you're a new subscriber, welcome to our channel. Our channel is just about love, family, lifestyle, God, anything, education, relocation, whatever it is, babe. So yeah, so today the last video we made was about like the whole process, delivery, childbirth, the hospital, everything, the whole thing. But we realized that there were some unanswered questions that a lot of people probably had and they did not ask, and some people asked.
Had to call on the phone and tell us that please, who want to give birth in Canada? What's the cost? Should we go to the UK? Should we go to the US? Should we go to Australia? Should we go to anywhere in Europe? What's the best? What's your suggestion and advice? So
today we decided to give you the unfiltered truth. What did it cost us? What did we actually spend to give birth in Canada? A lot of people that have been following our journey right from when we
arrived to Canada,
relocation, the process, packing, everything, you know that we came in February of this year, not too long ago. We came as permanent residents.
Actually, it's 5 months exactly yesterday or 2 days ago. Yeah, 5 months. Yeah, 5 months today, because we arrived like 2 days after or a day after.
Oh,
right?
Yeah, our flight was.
So we arrived on the 14th of February.
Yes.
Today is 14th.
Oh, babe.
So 5 months today in Canada.
Congratulate us, we've done so well.
Yeah, we've done so well.
My God.
Trust me.
It's been a journey. We'll talk
So how much did it cost us to give birth to Tiolu and Nini in Canada?
So in this video we'll be telling you about it, what we went through, our experience, our advice to you, and maybe comparing to what we've heard from people in other countries, what it costed them, how easy the process was, and things like that. But let's not waste much time, let's get right into the video. So when we came, for us, the first issue we even faced, let's not even talk about the birth, was that we needed to get a doctor. Now in Canada, how it works is you have to first have a family doctor,
family physician.
The first one, okay, so we had not even gotten health insurance at that time. We got insurance like March or something like that.
Yeah, our health insurance came like 2 or 3 weeks after. 3 weeks after.
Yeah,
3 weeks after. And also she was already 7 months pregnant at that time we arrived. So at 3 weeks to whatever she was, so it was already almost 8 months when we got our health insurance, our health card. And without that health card, you can't see doctor. If you're going to see doctor, you have to pay for consultation. Consultation was $120 just to see. And you pay every single time you go to what? To see. So like the moment we heard, we even went to a clinic. It wasn't like we're not willing to. We went to a clinic. When we now heard the cost, they're like, kilo day, we are both doctors. You know, like I didn't have any complication. I didn't have any of course, if you have an emergency situation, you can go to the hospital emergency and they will attend to you. You will pay, of course. So after we got the health insurance, we had to get a family doctor who now referred. The thing is, here is not like Nigeria. Back home, what we know is you can just go to any hospital.
You can go to an obstetric clinic and they will see you. You don't really need any drama, no whatever. But here, the first line of care is your family doctor. That's the person that will refer you to the obstetrician. Now the obstetrician will
to a specialist, to other specialists.
Whatever.
Which obstetrician is the one we needed at this point.
Yeah. So then they referred me, then the obstetrician continued the care up till going to the hospital, giving birth and whatever. So
for us, because we are permanent residents, or so it's either permanent resident or citizenship. So if you're a citizen or you're a permanent resident, they treat us almost the same, if not the same.
Yeah.
Do you get? So we didn't need to actually pay any money throughout the process.
Like not one
ultrasound,
blood tests,
All the tests. We did all the tests. Even me, I can't remember saying and they pay me. I did.
Through this.
I did everything. When we went to see the family physician, she, after they checked her and all, and I started complaining, me, my hand, they pay me. All those things, all those patients, they do me for Nigeria. Hey, I remember 4 years ago, I fell down.
Yeah.
And my hand is paining. Though request for all the tests. Trust me, I remember neck is paining me. Test, scan, ultrasound, X-ray, everything we were doing.
And we didn't have to pay
1 kobo.
However, of course, it can be different for different people. There are so many factors to these things. Like, if you don't have health insurance, you will pay out of pocket for health care.
Yeah. If you are not a citizen, if you are not a PR holder, maybe you are visiting, you just came for that purpose to deliver. There are people that come from Nigeria, maybe they are rich, their husband a politician, or there are people that come. I saw Bobby, the comedian, saying that he had to go, him and his family had to go to US to go and to give birth.
It's actually common.
It's a common thing. People do it. If you are financially capable, you can give birth, because there are some countries like Canada, US, it's citizen by birth.
Yeah.
Do you get what I'm saying? It's citizen by birth, and you don't have to wait for 9 minutes to start this process. Do you get what I'm saying? Do not wait for 9 minutes to start this process. Start the process as soon as you confirm that you have you are pregnant, you've conceived. Do you get what I'm saying? And you're already like 3 months gone. Make sure you have booked your appointment, because visas too can take a while. Do you get what I'm saying? And for you to to be allowed to travel,
they must.
You must at least be 7 months below.
There's a
very important.
These airlines. So I don't know if you've watched our video, the travel vlog. You will see that we mentioned what we went through to travel while I was pregnant.
They won't even allow you to travel if you are 8 months or 9 months. Just forget it.
Except if you can convince them that okay or something.
So I think we should talk by weeks. I think it's between 28 to 32 weeks or so.
Yes.
I will confirm and post it. And add it to this video.
And there are some other things you need to take when you are traveling as well.
Like medical report that you are fit to travel, or those kind of fit. They call it fit to travel.
Fit to travel, fit to fly documents. Your doctor will give you that. But for Canada, you need to, because there are so many things you need to do before you even get to the stage of giving birth, and you don't want anything to be last minute. You need to find a doctor. There are some obstetricians that will not accept you if you're already far along. That was an issue that we faced. Because I was at the time because when I saw the family physician, we had to start doing tests. They have to do a lot of things before you can even see. Obstetrician would barely really ask you to do a lot of tests, because they expect that your family physician has covered a lot of grounds before you came to see them. So by that time, I was already about 35, 36 weeks. A lot of hospital clinics did not want to accept us. So getting a doctor might be an issue, but of course, if you are fast, you get a doctor, and you will pay. From what I've heard, you might pay about $15,000 there. This is not for hospital. This is for like clinic visits and things like that. Whatever you do before childbirth, that's what that about $10,000 to $20,000 is for. Then for the hospital part as well, we also did not pay anything. We were there for 1 night, about 1 night sharp.
No, 2 nights.
Did you sleep the second night?
Yes, we did.
Oh yeah. Because of the doctor coming to discharge. 2 nights, we were there for 2 nights, and we didn't pay anything. But again, it depends. If you needed NICU admission, if you did cesarean section, anything at all, it might depend. But from what I've heard as well, you will pay in the hospital if you don't have health insurance, and the money is much. About $5,000 to $8,000 per day, per night. Till you sleep, you wake up.
And also for seeing doctors, we've said before, you have to pay $120 to just see the family physician.
That one is...
Also for gynecologists, you have to pay. It's different money. Every single time you have an appointment, you have to pay. And this money we are mentioning, $15,000, $8,000 per night, is not part of it. Do you get what I'm saying? They are total different. The $120 is just for consultation every time you see a doctor. I know most of you have paid that in Nigeria. That one is 15,000 there. but EF is 120,000 naira.
Why are you converting this?
Make they know.
So we hope we've answered a lot of your questions. That was majorly what we wanted to clarify in this video. Is there anything else?
Yeah, then for US, we don't really know because we've not been in the US. But with our research, it's also the same thing. If you don't have strong health insurance in the US, you are not a citizen. I think even if you can be a citizen and you should not have good insurance, if you don't have, I think they call it Medicaid and Obamacare.
Yeah.
So for Obamacare, is the general insurance that will not allow you just go. They will just send you. I don't know how their insurance work over there. But if you are a traveling patient that wants to give birth, it's about $30,000 to $50,000 so ahead in the US. For $30,000 to $50,000, convert it with 1,400. For Canada, let's say 20 to 40,000 Canadian dollars. That's 40 million naira. About 40 million naira. You spend about 40 to 50 million naira. But in the US, you are spending about 70 to 80 million naira based on conversion rate. Yeah. For Australia, I'm very sure it will be almost the same. For UK, do you have any
UK, you also don't pay if you are under NHS or something like that, because they didn't pay you. I think so, you won't pay. But if you are like traveling and all of that, you pay.
You pay,
yeah.
And it will be a lot. That one a pound, that one a 2,000 times whatever they ask you to pay. Do you get what I'm saying? But in Canada, yeah, there are some countries you don't want to go and give birth in the UK because it's not citizen by birth.
Yeah.
There are some countries that is not. Make sure you find out. There are some countries that are not citizen by birth. Do you get? US is citizen by birth. Even though Trump wants to cancel it, it was not successful. In Canada, it's citizen by birth. Even if you have no status, in as much you give birth to that child, there, automatic citizen. Do you get what I'm saying? And one advantage of giving birth in Canada than US is that, which I would advise US people, you better come to this place. They pay.
Like child support.
Child support, groceries, grocery money.
Family income.
Last month we collected for child support. Should we tell them? So we collected a lot of money. Yeah. Well over.
They take care of their children.
Yeah, they take care of their children. Last month they paid us 2 months for 2 months. So we collected way over 1,000 plus Canadian dollar. Yeah. Way over 1,200, like above that, way over. Then for this month, in total, we collected close to 900. Do you get what I'm saying? 1 month, then they also called something called grocery, something that's, they gave us 200 and something for groceries. Do you get what I'm saying? So they pay a lot. Yeah. They support families in Canada. Trust me, yeah.
So you can just ask us questions. I was checking my phone because I had some things written down, that's why. So you can ask us whatever you want to know in the comment section, and we'll do well to answer to the best of our ability. If we can, but if we can't, we'll see if we can make findings if it's necessary, and that's it. Yeah. So this video is a short one. This is it. That brings us to the end of the video.
And for those that want to do permanent residency process, anyways, we assist, we do mentorship, we do consultation. As I've said before, people are stressing me with this information. I want to cut this clip and post on TikTok because it's TikTok people majorly. So consultation is, we have a conversation and talk about the process. There are some people that are not qualified to even enter the process. There are some people that are qualified. What makes you qualify? Number one, if you have masters. Some people, they might not have masters, but they can still be qualified, like doctors, like pharmacists. Do you get what I'm saying? There are some courses that are called professional courses. You get. People will say, agency will say, that you have to have BSc, that when you have BSc is enough. But this Canada permanent residency is a point-based system that the higher your education, the better for you. The lower your age, the better for you. The more your work experience, the better for you.
English.
Your English, your IELTS or CELPIP, the better for you. So for example, someone that has BSc now, that is maybe 25 years of age, can still come to us, because we can still encourage the person to go for their masters, just 1 year masters, and you get, within that period we'll be able to gather all the necessary documents. There are some people that will say, oh, it's work experience. These are doable. All these things are doable. Do you get what I'm saying? But if you are maybe 35 and above, and you think, okay, you can still make it, what if you, some people might, their cases are different. So that's why I said, let's do a consultation, let's talk about this process. If you are not qualified to enter the permanent residency pathway, there are other pathways that can still get you permanent residency, that will bring you into Canada, then eventually you get permanent residency. That's why I charge money for my consultation. We discuss for an hour, then you have access to me anytime. You can text me, ask me any question. If I'm free, I can even call you again, explain and explain. There are people I have explained 1 billion times to. They still come back, but I'm happy to re-explain. You get, so please and please, I'm going to cut this part and post on TikTok, but I'm just saying it again. For those, you can reach out to me on our social medias, at Dr. Beams on TikTok, and please subscribe to this channel. Share it on your WhatsApp status. Share it to your friends. You don't know who you are going to help. Do you get? There are a lot of people that will reach out to us and say, oh, we saw this thing on a friend's story, we saw it here, we saw it there. You've helped 1 or 2 people. Do you know how many people have gotten invitation to apply, are in the pool now, that we've helped to enter the pool? Uncountable. Canada permanent residency now is very slow, but in as much you are in the pool, you have done the necessary stuff, your chances is high of getting it. Or like when they give you ITA is 99%. Do you get? When you are in the pool and you have good score, it's like 100% of getting ITA. Do you get what I'm saying? Why I said 99% after getting ITA, invitation to apply, is that it depends on the document you submit and how you submit your document. Some people who can do rubbish. Do you get? That's why you need mentors. They deny people, not because say Canada don't invite you, no mean say they will give you. Do you get what I'm saying? I know of 1 or 2 people they've denied. Do you get what I'm saying? That's why you have to do the right thing. And for you to get the right thing done, you pay for the right people to get you to do it right. And that's why we are here for you. Anyways, thank you so much. Do you have anything to say?
No, that brings us to the end of this video. See you again next time. Bye.
Subscribe.